I think most internists, when they don't know what something is, wish that they could have somebody to guide them, because dermatology training in medical school and any non-dermatology specialty is minimal. So most non-dermatology physicians don't know that much about dermatology, and it leaves them a little bit. It really is unfair to ask an internist to recognize a skin lesion, understand what the differential diagnosis is when it's a complicated patient. I think more often than not they would like to have somebody to ask questions to. There are only a few weeks at most medical schools. Some medical schools are lucky enough to have a little bit more than that, where there's required dermatology training in medical school. Then you can do an elective if you're interested or your specialty requires that you know a little bit more. And that's it. In your residency, especially if you have a primary care type residency, you can elect to do electives in a dermatology clinic wherever you're doing your residency. But again, that's it. So the problem is not that we don't want to teach in medical school. The problem is that the medical school curriculum doesn't allow us much time. No matter how much we ask for it, we're actually not given a lot of time. There are efforts to address that through online modules, online continuing education. The American Academy of Dermatology has a nice link for any private or any general practitioner or medical students who are interested in learning about more dermatology. They can go to these online modules, which are available to everybody, and that's a great place for self-teaching. So we're trying to address the teaching issue at the same time as respecting that we can't force ourselves into curriculum where we're not invited. We're beginning to have some fellowships in the country. I have one at UCSF, and I know there's one being developed at Harvard and one perhaps at Penn and at NYU. So we're starting to think about more how to train the next level of person to then go out into the community or go out to places where there aren't necessarily academic centers and go practice hospital dermatology there. And like I said, the other issues are trying to figure out what the community needs and deliver it, and find out what the gaps are and solve those. So eye diseases are so rare, especially when they get so severe that you end up in the hospital for them, that trying to collect enough information and enough patients to do a prospective study is quite difficult. So the Society of Dermatology Hospitalists and the Medical Dermatology Society are two societies where we're starting to pool data and try and study these diseases in a better way.